Chapter 20, the cardiovascular system, blood vessels and circulation. Part 1. Here's your table of contents. And in part 1.1, we will talk about structure and function of blood vessels and differences between arteries and veins. So what are blood vessels? It's a delivery system of dynamic structures that begin and ends at the heart. So when our heart pumps blood, it pumps it into the arteries, aorta and pulmonary artery. Through aorta and its branches, through the arteries, oxygenated blood goes to absolutely all organs and tissues of the body, where gas exchange is happening in the capillary beds of each organs. Oxygen goes to the tissues, carbon dioxide goes to the blood. The deoxygenated blood right now through the veins will be transported back to the heart. The only exception from that rule would be pulmonary circulation, where a pulmonary artery carries deoxygenated blood to the lungs, where that blood receives oxygen, and that oxygenated now blood returns back to the heart. So arteries and veins have a lot in common. Each of them is made of 1, 2, 3 layers. And those layers, starting from the inside, are called tunica intima, tunica media, tunica externa. And lumen is that central space where blood actually is located. Vasa vasorum. Our large arteries and veins, like aorta for example, in their walls have smaller blood vessels that provide their muscles and tissues with oxygen, and those tiny blood vessels are called vasa vasorum. Tunica intima, the inner layer of arteries and veins. Here it is. And it's endothelial tissue, and in large vessels there will be internal elastic membrane made of a lot of elastic fibers. Tunica media right here would be made of smooth muscles and elastic fibers. The blue ones would be elastic fibers. Most of them will be in the arteries, less in veins. And those smooth muscle cells are controlled by sympathetic nerve fibers. They are called nervi vasorum, causing vasoconstriction and vasodilation. So when a nervous signal, action potential, comes through the sympathetic nerve fibers, blood vessels constrict and blood pressure increases. When there is no signal through the sympathetic nerves, blood vessels, smooth muscles relax, diameter becomes larger, and blood pressure drops. And finally, there is tunica externa, this layer, and this layer has a lot of collagenous fibers for protection and reinforcing, for keeping the shape of the blood vessel, and also those vasa vasorum, tiny blood vessels, providing with nutrients and oxygen those muscle cells. There are differences between tunics in arteries and veins, which you need to know. First of all, general appearance. Pay attention. Arteries are round, veins usually look flat. Arteries have thicker walls comparing with veins and small lumen comparing with lumen of veins. Tunica intima in the artery is wavy because there are a lot of elastic fibers and it can expand a lot. Tunica media is much wider in arteries comparing with veins, but tunica externa is usually thicker, pay attention right here, thicker comparing with arteries. Those are major differences that you're supposed to know. There are 3 types of arteries depending on their size. Those large arteries originating from the heart, like aorta, like pulmonary arteries, they are larger than 10 millimeters or 1 centimeter. It's approximately half an inch in diameter. And they are called elastic or conducting arteries. They have thick walls with a lot of elastic fibers and thick muscle layers. So major branches of aorta would be elastic arteries. Large lumen, and it offers low resistance. It means such a large opening right here provides less resistance to the blood flow. And they act as a pressure reservoirs. They can expand and recoil as blood is ejected from the heart. Next one, second, muscular arteries. They have smaller diameter from 0.1 millimeters to 10 millimeters, and they deliver blood to body organs. Very often they even named after the organs they deliver blood to, like hepatic artery carries blood to the liver, gastric artery to the stomach, or for example ovarian artery to the ovaries. They have thick tunica media, a lot of smooth muscles, and they are active in vasoconstriction. Why? Because sometimes organs, when they are not functioning right now, for example, when stomach is not digesting food, those organs do not require a lot of blood, so smooth muscles constrict and reduce amount of blood going to certain organ at that time. Arterioles, finally, are the smallest arteries. Their diameter is smaller than 0.1 millimeter, and their muscular layer is made of 1 or 2 layers of cells only. They lead to capillary beds. Those are inside of the organs where a gas exchange happens. And they control blood flow into those capillary beds through vasodilation and vasoconstriction. Before you continue, please answer the questions for part 1.1. Part 1.2. Capillaries. Capillaries are microscopic blood vessels which are located right here inside of the organs. They are called exchange vessels because their main function, exchange of gases. Oxygen goes to the tissues, to the cells located between those capillaries, and carbon dioxide goes out of them. Also, capillaries deliver nutrients and hormones to the tissues and remove wastes from them. They only have one cell thick walls. Here's one cell sitting on the cell membrane, basement membrane, and those would be endothelial cell. Remember, how do we call a type of epithelium when there is only one layer of flat cells sitting on the basement membrane? That would be simple squamous epithelium. On the outside, there is a special type of cells called pericytes that keep those walls stabilized and control their permeability. Their size is very small, so only one red blood cell can go through those capillaries at a time. There are only a few tissues where we do not have capillaries. Those would be cartilage, epithelia, example will be epidermis of the skin, and also cornea and lens of our eyes. When blood flow is going through capillaries, it is called microcirculation. There are 3 types of capillaries by structures: continuous, fenestrated, and sinusoidal. Continuous capillaries. There are a lot of them in the skin, in the muscles, and also in the brain. Between the cells there are very tight connections, tight junctions. So substances can go only through their cells themselves, and those substances will be lipid soluble, usually small molecules. And the continuous capillaries of the brain create blood-brain barrier. Fenestrated capillaries have openings in their walls, so they are more permeable than continuous capillaries. And example of them would be small intestines, where intestines digest food and that food get absorbed to the blood, food molecules, amino acids, fatty acids, carbs, through the walls of fenestrated capillaries to the blood. Endocrine glands, when they produce their hormones, they release hormones into the blood vessels through those fenestrations. And fenestrations help kidneys to produce urine. Finally, sinusoidal capillaries have large, huge openings, gaps in their walls. And it happens in the places where very large molecules and even blood cells have to go into or out of the bloods. Examples: bone marrow produces blood cells, red blood cells and white blood cells, and those have to go from the bone marrow into the blood through those large gaps. Or when red blood cells become old and worn, they can go through the blood, out of the blood, through the gaps in those sinusoidal blood vessels, into the spleen, where as they die will be separated into parts and used for other purposes. Medarterials are tiny vessels that originate from arterial right here. Here they are. That is a medarterial. They arise from terminal arterial. Medarterials have a lot of precapillary sphincters. All those capillaries originating from medarterials are regulated by the capillary sphincters. When that organ or tissues where the capillary bed is located is not working right now, like muscle is not contracting and it doesn't need a lot of oxygen and nutrients, then precapillary sphincters will contract and diminish amount of blood going to that tissue. Then through fair channels connect the terminal arterial and a postcapillary venule, this one. What else about capillary beds? If all of those precapillary sphincters are closed, the blood goes only through the medarterial and through fair channel and doesn't go into the capillaries, and in this case the organ doesn't receive a lot of blood and it's called vascular shunt. Here it is, the way of the blood. When those surrounding tissues need more oxygen, precapillary sphincters open and blood goes through, filling in all those cells with oxygen and nutrients. So that sphincters open, blood goes through absolutely all those capillaries, and that is sphincters closed. In some cases, between arterial and between venule, there is a straight connection, like a tubule connecting them, which is called arterial anastomosis. It's just an alternative pathways for the blood. We don't have too many of them. Venules. Venules is in a small vein. It means it's no more than 100 micrometers in diameter. And the venules are formed when capillary beds unite. All those tiny capillaries merge together and form venules. Venules are very porous. Their walls are so porous that they allow fluids and even white blood cells to go into tissues. And that is important, for example, in case of inflammation, when white blood cells are supposed to leave blood vessels, go to the tissues and fight bacteria or viruses. Those post-capillary venules consist of endothelium. Here it is, endothelium, one layer of cells, and pericytes. Pericytes sitting on the top of them, keeping them together. Larger venules have one or two layers, sometimes a few more, of smooth muscle. Mid-sized veins are larger than venules, and general definition for a vein, it's a blood vessel that conducts blood toward the heart. That's what they do. And veins are formed when venules converge. Veins also called capacitance vessels or blood reservoirs because they contain about 60 to 70% of blood supply at the time. So that's a mid-sized vein right here. Comparing with arteries, veins have thinner walls on average, larger lumens, we said about it already, and blood pressure is always lower in veins comparing with arteries, and tunica media, which is your smooth muscle layer, is thinner in veins comparing with arteries, and it has less of elastic fibers. Adaptations that ensure a return of blood to the heart. First of all, large diameter lumens of veins offer little resistance to blood flow up to the heart. And finally, valves. Right here there are valves. When blood goes through the veins up, it cannot return back because valves close and prevent blood flow back. Venous sinuses, it's a name for large veins that usually are flat and they have very thin walls. Example would be your coronary sinus on the posterior side of the heart. This table 20.2 compares arteries and veins, and you need to know all that information for your exam. Before you continue, please stop the video and answer questions for part 1.2. We are done with anatomy of arteries and veins, and now we will be talking about physiology of circulation. Let's start from definitions. First of all, what is blood flow? Certain volume of blood flowing through a blood vessel or organ or through the entire circulation in a given period is called blood flow. Usually it is measured in milliliters per minute. How many milliliters per minute went through a certain blood vessel. And it can vary widely through individual organs, blood vessels, and based on the needs of those organs. When muscle is relaxed and not working, blood flow through it will be less than when that muscle is contracting and relaxing doing some work. Blood pressure. It's a force exerted on the wall of blood vessel by the blood. So it's a force going from the inside of blood vessel on its walls. And it's measured in millimeters of mercury. And it's usually measured as systemic arterial blood pressure in large arteries near the heart, like aorta. There is a resistance to their blood flow or measure of the amount of friction that blood encounters in the peripheral systemic circulation. Arterial blood pressure, let's start from this one. So again, it's a force exerted by blood against the walls of a blood vessel from the inside of that blood vessel. And arterial blood pressure in larger vessels consists of several components: systolic blood pressure, diastolic pressure, pulse pressure, and mean arterial pressure. Look at picture 20.10. Systolic pressure. It's a pressure exerted during ventricular contraction or ventricular systole. When ventricles contract, blood pressure in aorta goes approximately to 120 millimeters of mercury. Here it is, contraction, high blood pressure here, another contraction. When ventricles relax, blood pressure goes all the way down right here, and that would be diastolic pressure, the lowest level of arterial pressure during ventricular diastole or relaxation. The difference between those two is called pulse pressure. So if your blood pressure is 120 to 80 millimeters of mercury, your pulse pressure would be 120 minus 80, 40 millimeters of mercury. The next term is mean arterial pressure, or it's the average pressure in the arteries during one cardiac cycle or one cardiac contraction. And there is a formula how you can calculate your mean arterial pressure. It would be diastolic blood pressure plus systolic minus diastolic blood pressure divided by 3. So if your blood pressure is 120 to 80, first diastolic blood pressure would be 80. Systolic minus diastolic blood pressure would be 120 minus 80, that would be 40. 40 divided by 3 would be 13.3, and plus diastolic plus 80 would be 93.3 millimeters of mercury. Pulse pressure and mean arterial pressure both decline with increasing distance from the heart. What does that mean? When arteries branch to arterioles, blood pressure goes down inside of those. It's even lower in the capillaries, even lower in venules, and finally, when blood arrives back to the heart through vena cava superior and inferior, the blood pressure goes close to 0. Pulse. After blood is ejected from the heart, elastic fibers in the arteries expand to accommodate the blood, then recoil. And if you press your fingers against the artery, which is close to the skin, you can feel it as a pulse. If you calculate it, you will receive heart rate. The average normal heart rate is 60 to 100 beats per minute. And the pulse must be measured clinically to provide clues to patient's state of health. It's recorded as beats per minute, what I said. Pulse can be palpated manually in many places of the body. Usually we do it on a radial artery, but there are several places, like it's common to count it on carotid artery, common carotid artery. It also can be checked on other arteries of the body. Now, how to measure blood pressure? Sphygmomanometer is a device that is used to check a blood pressure. That cuff is wrapped around the arm, and right here in the arm we have a brachial artery, and when the cuff is inflated, the blood flow through the brachial artery stops. It happens when pressure is increased in the cuff and exceeds systolic pressure in the brachial artery. Then, when you start releasing pressure slowly, you won't hear any sounds. And only when sounds first happen, as blood starts to spurt through the artery, right here, during the systole, it will be called systolic pressure. Artery opens a little bit and small amount of blood goes through it. Then during the diastole, blood pressure drops and sound disappears. It continues for a while. Those sounds called the sounds of Korotkoff or Korotkoff's sounds, and that when the first sound happens, it's called systolic pressure. When brachial artery stays open, it's no longer constricted during the diastole, it's called diastolic pressure, and normally it's 70 to 80 millimeters of mercury, while systolic pressure shouldn't be more than 110 to 120. 140 nowadays is considered to be a little bit too high for a normal blood pressure. But you still can find it in many medical books. Variations in blood pressure. Blood pressure cycles over a 24-hour period. Usually it's higher in the morning due to level of hormones like cortisol. Also, blood pressure usually increases with age. It depends on sex, on weight, on race, even on your mood. When you are under stress, your blood pressure usually goes up. And even posture can increase blood pressure when you are standing. Hypertension is a condition when blood pressure is chronically elevated. It means when you measure blood pressure several times within certain period of time, days, and it persistent blood pressure higher than 140 to 90, it's called hypertension. Blood pressure between 120 to 80 and 140 to 90 usually are defined as pre-hypertension. It can be transient, temporary, like adaptation during fever, physical exertion, emotional upset, stress, or often it happens in people with a lot of extra weight. When hypertension lasts for a long time, it is a very dangerous condition. It can cause heart failure, diseases of blood vessel, vascular disease, failure of kidney, renal failure, and stroke. Why? Generally speaking, all of those organs have to work under the pressure that wears and tears them very fast. There are two types of hypertension. Primary or essential hypertension makes about 90% of all hypertensive conditions, and it can happen due to risk factors, which you need to know. That would be heredity, running in the family, poor diet, obesity, age, stress, diabetes, and smoking. Secondary hypertension is less common and usually caused by originally primary disease in certain organ, for example kidney disease or some endocrine disorders. Before you continue, please stop and answer the questions for part 1.3. Now, what can affect blood flow and blood pressure? There are 5 variables influencing blood flow and blood pressure: cardiac output, compliance, volume of the blood, viscosity of the blood, and the length and diameter of the blood vessels. First of all, cardiac output. It's amount of blood from the heart through the ventricles. How much blood heart pumps, and it's measured in liters per minute. Here are several factors that cause cardiac output to increase, and that will elevate blood pressure. Sympathetic stimulation, as well as production and release of epinephrine and norepinephrine by adrenal glands. Both of those happen during stress or physical activity. High level of thyroid hormones or increased level of calcium. Factors that decrease cardiac output will also decrease arterial pressure, and that would be parasympathetic stimulation when we are resting and digesting, and also it can be either elevated or decreased potassium ion levels, decreased calcium level, and acidosis, low pH of blood. Next, on blood volume. When amount of blood in the system, blood volume, decreases, when we lose fluid, blood pressure goes down. As blood volume increases, blood pressure and blood flow increase too. Usually, blood volume doesn't vary a lot, but when it's low, it's called hypovolemia, and it may be caused by losing blood with bleeding, dehydration caused by vomiting, for example, or severe burns, or by some medications used to treat hypertension. To treat hypovolemia usually includes intravenous fluid replacement. Hypervolemia, or excessive fluid volume, may be caused by retention of water and sodium, which can be caused by either heart failure, liver cirrhosis, or sometimes some certain kidney diseases. Compliance is ability of a blood vessel to expand to accommodate surges in blood flow without increased resistance or blood pressure. Blood vessels naturally are very elastic, and they can expand easily and return to their original condition. Veins are more compliant than arteries, but when vascular disease that happens with many people with age, when it happens, it causes stiffening of arteries, arteriosclerosis, and compliance is reduced, and resistance in blood flow causes high blood pressure. Blood viscosity, or simply thickness of the blood. Just imagine, what would be easier for your heart to do? Pump water or pump honey? Of course, pumping water. Pumping honey would demand a lot from the heart because how thick it is. So blood viscosity is directly proportional to resistance and inversely proportional to blood flow. The higher is blood viscosity, the lower would be blood flow, and the more difficult for the heart it will be to pump that blood, and the higher will be blood pressure. There are several conditions that can cause high blood viscosity. One of them would be dehydration and also polycythemia, or higher amount of red blood cells. Number 5, blood vessel length and diameter. The length of blood vessel is directly proportional to its resistance. The longer is the blood vessel, the greater will be resistance to the blood flow, and the lower will be blood flow. It means when we have a lot of extra tissues, which happens when we gain weight, those tissues, that fat tissue, requires blood vessels, so the length of all blood vessels increases. An individual weighing 150 pounds has approximately 60,000 miles, yes, miles, of blood vessels in the body, and here we count tiny capillaries also. Gaining about 10 pounds adds about 3,000 miles of blood vessels, which makes the heart working much harder. Weight reduction reduces stress to the heart, which does not have to overcome the resistance of as many miles of vessels, and usually slows down the blood pressure. Okay, blood pressure inside of the veins doesn't change a lot during the cardiac cycle, and it's much lower comparing with blood pressure in the arteries. There are two factors that help to maintain a venous blood pressure gradient between the veins and the heart, and those would be skeletal muscle pump and respiratory pump. That is our thoracic cage and a diaphragm, and here is vena cava inferior, going all the way up to the heart to enter the right atrium. And respiratory pump, it's when breathing moves the diaphragm and changes the pressure. The blood is moved towards the heart by squeezing abdominal veins, and at the same time thoracic veins expand. That is respiratory pump. Muscular pump is created in the skeleton by the skeletal muscles in our arms and especially in our legs. When muscles work, when we're walking, those skeletal muscles squeeze veins between them and milk blood towards the heart all the way up. When muscles relax, the backflow of the blood is prevented by the valves. Please remember to answer the questions for part 1.4.